Chronic conditions like type 2 diabetes, hypertension, and heart disease are now the leading drivers of illness and healthcare costs. Our traditional healthcare models, built for acute care, struggle to manage these long-term, lifestyle-driven diseases. The real work of chronic disease management happens between office visits, in daily choices, habits, and self-monitoring. Yet most patients lack the support and resources to sustain these changes on their own. We need a scalable, technology-driven approach that empowers patients every day, not just during appointments. The future of healthcare lies in extending care beyond the clinic, using digital tools to guide, support, and connect with patients continuously. Enter Omada Health, a digital care platform transforming chronic disease management. Omada brings care directly to patients through smartphones and connected devices, focusing on prevention and management of conditions like diabetes and hypertension. The program combines data science, clinical protocols, and, crucially, human coaching. Participants receive smart devices and join a supportive peer group, creating a feedback loop for real-time, personalized guidance. Omada shifts care from reactive to proactive, targeting the behaviors that drive chronic disease. The goal: prevent disease progression and improve outcomes through daily, personalized support. This is healthcare that's accessible, scalable, and deeply integrated into everyday life. For healthcare professionals, Omada is a powerful extension of your care. It bridges the gap between office visits, providing daily support and accountability for patients. Omada operationalizes your recommendations, helping patients turn advice into action. The platform's data gives you a continuous view of patient progress, enabling more informed, collaborative care. As digital health becomes standard, understanding these tools is essential for modern practice. This overview will equip you to leverage digital care for better patient outcomes. Omada's journey starts with a simple digital invitation, often from an employer or health plan. A quick online screener identifies those at risk for chronic disease. Eligible participants receive a welcome kit with connected devices, bridging digital and real-world care. The Omada app guides users through setup, making technology accessible for all. Each participant is matched with a health coach and a small peer group, fostering immediate community and support. This seamless onboarding builds the foundation for lasting engagement and change. Omada's connected devices, like smart scales and blood pressure monitors, automatically sync data to the app, making tracking effortless. This real-time feedback turns abstract health goals into visible progress, motivating daily action. The Omada app is the central hub. It visualizes data, delivers interactive lessons, and connects users to coaches and peers. Secure messaging enables private, personalized guidance from health coaches. Group boards foster peer encouragement and shared success. Integrated food and activity tracking allows for tailored feedback. The result: a single, user-friendly platform that empowers participants to manage their health every day. Omada's digital tools make healthy change practical and sustainable. Omada's health coaches are real professionals, experts in nutrition, exercise, and behavior change. They monitor participant data, provide timely feedback, and offer encouragement through secure app messaging. Coaches help set realistic goals, troubleshoot barriers, and celebrate progress. Their support is empathetic and non-judgmental, making change feel possible. This ongoing, personalized relationship keeps participants engaged and accountable. The human touch is what transforms digital care into lasting results. Omada's coaches are the heart of the program, driving real, sustainable health improvements. Beyond the one-on-one health coach, Omada integrates a peer group. Each participant is placed into a private online community of about 10 to 15 members. This creates camaraderie and mutual understanding. The peer group functions as a digital support network, accessible 24/7. It is a safe space where members can share struggles and successes without fear of judgment. The responses from their peers provide a powerful source of validation, encouragement, and practical advice. This blend of professional guidance and peer solidarity creates a rich, multi-layered support system. To understand the Omada platform, visualize a typical week for a participant. The experience integrates into daily life, not as a chore. Each week begins with a new lesson in the app. A participant might find a lesson focused on understanding food labels. Throughout the day, interactions with the platform are seamless. In the morning, they use their smart scale, and the data instantly syncs to their app. When preparing meals, they might use the app's food tracking feature. After an evening walk, they can log that activity. These actions build a comprehensive picture of their daily habits, powering personalized coaching. Perhaps the participant messages their coach. On Thursday, the participant might see a post in their peer group. By the end of the week, the participant has engaged in learning, action, tracking, and support. This entire ecosystem works in concert. It is this multi-pronged approach that transforms the task of changing one's health. Omada Health's approach is rooted in rigorous clinical science. The Diabetes Prevention Program, or DPP, a federally funded study published in 2002, was a game changer. It compared lifestyle modification to medication. The lifestyle program reduced diabetes risk by 58%, more effectively than medication. It focused on achievable goals, modest weight loss and exercise. Omada Health saw an opportunity to translate the DPP into a scalable digital platform, overcoming geographical barriers and delivering clinically robust prevention at a fraction of the cost. A clinical protocol is only effective if people can stick with it. Omada deeply integrates the principles of behavioral science, helping people change long-standing habits. A core concept is breaking down overwhelming goals into small, manageable steps. The program focuses on achievable weekly goals, building confidence and momentum. The program also leverages the power of tracking and feedback to drive self-awareness. Another key principle is social accountability and support through a health coach and peer group. Finally, Omada's curriculum is designed to reframe a participant's mindset. Omada empowers participants with the mental and emotional skills needed to sustain their new habits. Building on the success of its diabetes prevention program, Omada Health has strategically expanded its clinical model to address other major chronic conditions, most notably hypertension and musculoskeletal issues. This expansion was not simply a matter of rebranding the same program. Instead, Omada applied the same rigorous, science-first methodology to develop distinct, evidence-based care pathways for each condition. The core platform, combining digital tools, data monitoring, and human coaching, remains the foundation, but the clinical content, specific devices, and coaching protocols are carefully tailored to the unique needs of each patient population, ensuring clinical relevance and effectiveness across different diseases. For its hypertension program, Omada's clinical approach is aligned with guidelines from the American Heart Association and the American College of Cardiology. Participants receive a connected blood pressure monitor, allowing for frequent at-home readings. The curriculum focuses on key lifestyle factors known to impact blood pressure, such as reducing sodium intake, adopting the DASH, or dietary approaches to stop hypertension, eating plan, managing stress, and the importance of medication adherence. The health coaches are specially trained in hypertension management, helping participants understand their readings, identify trends, and work collaboratively with their primary care physicians to optimize their treatment plans. The musculoskeletal or MSK program represents another thoughtful extension of the Omada model, tackling issues like chronic back, knee, and shoulder pain. This program pairs participants with a licensed physical therapist for virtual consultations and ongoing guidance. Instead of just a scale or blood pressure cuff, the technology here includes computer vision, which uses a smartphone's camera to track a user's movements as they perform prescribed exercises. This allows the physical therapist to assess form, provide real-time feedback, and progress the exercise plan remotely. The program combines this advanced technology with education on pain science, ergonomics, and behavioral strategies to manage chronic pain effectively. This multi-condition platform approach creates a more holistic and integrated care experience. A single individual may be dealing with both prediabetes and high blood pressure, which is actually a very common scenario. With Omada, that person can be supported for both conditions through one unified platform, with a coaching team that can address their health needs in a coordinated way. This prevents the fragmented care that often occurs when patients have to juggle multiple apps, devices, and programs. By building a flexible yet clinically rigorous platform, Omada is able to provide comprehensive, person-centered care that addresses the reality of comorbidity in chronic disease management. The Omada platform transforms data into an active clinical instrument. Omada provides a continuous view of a patient's health behaviors. The automatic syncing of data provides a rich data set that reveals trends. This is a powerful tool for the clinical team, allowing proactive and personalized care management. This triggers timely intervention and personalized support. This level of detail is impossible in a traditional setting. it allows for early intervention, bridging the gap between self-management and urgent care. This creates a learning health system, improving programs for future members. This ensures Omada's foundations evolve based on real-world evidence. In the rapidly expanding landscape of digital health, maintaining clinical rigor and proving efficacy is paramount. Omada Health has distinguished itself by making a deep commitment to evidence generation and validation from its inception. The company understood that for its platform to be trusted by health plans, employers, and most importantly, healthcare professionals, it needed to demonstrate its impact through peer-reviewed, published research. This commitment goes far beyond marketing claims or internal case studies. Omada has published numerous studies in reputable medical journals, including the first-ever peer-reviewed study of a digital DPP, demonstrating that its program could achieve clinically meaningful weight loss comparable to in-person interventions. This dedication to research serves several crucial functions. First, it validates the clinical model. By subjecting its outcomes to the scrutiny of the scientific community, Omada provides objective proof that its digital approach leads to tangible health improvements, such as significant A1C reduction in individuals with type 2 diabetes or sustained blood pressure control. This body of evidence is essential for earning credibility and establishing the program as a legitimate extension of the healthcare system. It gives healthcare providers the confidence to refer their patients and health plans the justification to cover the program as a medical benefit, treating it as a true clinical intervention. Second, Omada employs a robust internal clinical governance structure to ensure its programs remain safe, effective, and up-to-date with the latest medical guidelines. The company maintains a clinical advisory board composed of leading experts in endocrinology, cardiology, behavioral science, and public health. These advisors provide oversight and guidance on the development and refinement of all clinical protocols. This ensures that the educational content, coaching methodologies, and risk alert thresholds are aligned with the current standards of care. This internal system of checks and balances is critical for maintaining quality and safety as the platform scales to serve hundreds of thousands of members. Finally, Omada's clinical foundation is strengthened by its pursuit of third-party certifications and recognitions. Its diabetes prevention program was one of the first digital programs to receive full recognition from the Centers for Disease Control and Prevention, or CDC, a designation that requires programs to meet high standards for engagement and achieve proven weight loss outcomes. This external validation provides an independent stamp of approval on the program's quality and effectiveness. By actively participating in peer-reviewed research, maintaining strong clinical governance, and securing official recognition, Omada demonstrates a deep-seated commitment to ensuring its digital innovations are built upon a solid and trustworthy scientific foundation. The ultimate test for any healthcare intervention is whether it improves the health of real people in a meaningful way. The data collected from hundreds of thousands of participants paints a clear and compelling picture of success. In its diabetes prevention program, participants consistently achieve and maintain an average weight loss of 4 to 5% after 1 year. Participants in Omada's diabetes management program have shown an average reduction in their A1C levels of 1.4%. In the hypertension program, members see a drop in blood pressure that is clinically significant. What makes these outcomes so powerful is that they are achieved in a real-world setting. It is a practical tool that delivers measurable, life-changing health improvements. The individual patient outcomes achieved by Omada are impressive, but the true power of a digital health platform lies in its ability to scale that impact across entire populations. Employers and health plans that partner with Omada are looking for a solution that can measurably improve the health of their entire member or employee base. Omada's model is designed to do exactly that. By making the program accessible, it can engage a large number of people who are at risk for or living with chronic disease, many of whom might not otherwise seek or receive care. This ability to reach a broad audience is a critical first step in creating a population-level impact. Omada's digital delivery overcomes many of the traditional barriers to care. This democratization of access allows health plans and employers to offer a consistent and effective benefit to all their members, helping to address health disparities. In healthcare, clinical outcomes and economic impact are two sides of the same coin. For any new intervention to be widely adopted, it must demonstrate not only that it improves health, but also that it is a wise financial investment. Omada Health has focused heavily on proving its economic value to its partners, which are typically large, self-insured employers and health plans who bear the financial risk of their population's health. The logic is straightforward. Preventing or better managing a chronic disease is far less expensive than treating its severe complications down the line. A single hospitalization for a heart attack or a new case of diabetes can cost tens of thousands of dollars. Omada's ability to generate cost savings stems directly from its proven clinical outcomes. By helping individuals with prediabetes lose weight, the program directly reduces the likelihood that they will develop type 2 diabetes, thus avoiding the substantial lifetime costs associated with diabetes care, including medications, supplies, and specialist visits. For those who already have diabetes or hypertension, better management leads to a lower risk of expensive complications like kidney failure, amputations, or stroke. These avoided medical events represent significant hard dollar savings for the health plan or employer paying the claims, making the upfront investment in the Omada program a financially sound strategy. To quantify this impact, Omada and its partners conduct detailed return on investment, or ROI, analyses. These studies compare the medical spending of a group of people participating in the Omada program to a matched control group of non-participants over a period of several years. Consistently, these analyses show that the Omada-engaged population has lower medical costs. For example, peer-reviewed studies have demonstrated that for every dollar invested in the Omada program, health plans and employers can see a return of $2 to $3 in medical savings within a few years. This clear, data-backed ROI is a powerful argument for adoption. Beyond the direct medical savings, there are also indirect economic benefits. A healthier workforce is a more productive workforce. Employees who are successfully managing their chronic conditions often report having more energy, better focus, and fewer sick days. This reduction in absenteeism and presenteeism can translate into significant productivity gains for an employer. While harder to quantify than direct medical claims, these indirect savings are a real and valuable byproduct of investing in employee health. By delivering on both clinical and financial fronts, Omada presents a compelling value proposition that aligns the interests of the patient, the provider, and the payer. Clinical data provides hard evidence for Omada's impact, but the true story is best told through individual experiences. Behind every data point is a person whose life has been profoundly changed. These stories illustrate the program's real-world impact far beyond the numbers. They speak to the renewed sense of hope and empowerment that comes from taking control of one's health. These are stories of people like a father who, after losing weight with Omada, now has the energy to play with his young children. There is the experience of a woman in her late 60s who shared that for the first time, she felt like a partner with her doctor in managing her health. These narratives highlight how Omada's blend of technology and human empathy resonates with people from all walks of life, improving their quality of life. In the world of medicine and healthcare, anecdotal success stories are inspiring but rigorous. Scientific validation is essential for widespread acceptance. Omada Health has consistently prioritized this principle, investing heavily in peer-reviewed research to prove the effectiveness of its digital care model. This commitment sets it apart from many other digital health companies. Instead of relying solely on internal data or marketing claims, Omada has subjected its programs and outcomes to the intense scrutiny of the scientific community. The company has published dozens of studies in respected academic and medical journals, creating a robust portfolio of evidence that substantiates its impact in the real world. The first landmark study, published in the journal The Diabetes Educator in 2015, was a pivotal moment. It was one of the first large-scale, peer-reviewed analyses of a digital diabetes prevention program. The study demonstrated that participants in Omada's program achieved weight loss outcomes at 1 year that were comparable to those seen in the original in-person diabetes prevention program clinical trial. This was groundbreaking because it provided strong evidence that a digital intervention could replicate the success of the gold standard, resource-intensive model, proving the viability of a scalable, technology-based solution for this massive public health problem. Since that initial publication, Omada has continued to build its evidence base across its different programs and over longer periods. Follow-up studies have demonstrated the durability of the results, showing that participants maintain clinically significant weight loss and health improvements at 2 years and 3 years. Other research has focused on different populations and conditions, with studies validating the effectiveness of the hypertension management programs and diabetes management programs in reducing blood pressure and A1C levels. This ongoing research demonstrates a commitment to transparency and a culture of continuous learning and validation, reinforcing the clinical credibility of the platform. This body of published research is critically important for healthcare professionals. It provides the assurance that when you consider a platform like Omada for your patients, you are looking at an intervention that is backed by solid scientific proof, not just clever marketing. It allows you to have confidence that the program is based on sound clinical principles and has been shown to work in real-world settings. This commitment to peer-reviewed validation is a key reason why Omada has earned the trust of more than 1,700 employers and health plans, and why it is recognized as a leader in the field of digital chronic disease management, bridging the gap between innovative technology and evidence-based medicine. Omada Health is designed to be a partner, an extension of your care that fills the gap between office visits. It takes your clinical recommendations and provides the daily structure and support needed to help your patients put them into practice. Omada reinforces your clinical authority and supports the care plan you have established. The goal is to create a more cohesive and comprehensive care experience, where the patient feels supported from all sides, augmenting your efforts and improving outcomes. For clinicians on the front lines, a key question is how a digital program like Omada can practically fit into an already busy clinical workflow. The good news is that the integration is designed to be low friction and primarily opportunistic. The most common point of integration is during the patient conversation. When you identify a patient who is at risk for or diagnosed with diabetes or hypertension, and who could benefit from intensive lifestyle support, you have a new tool to offer. Instead of just providing a pamphlet, you can now refer them to a specific, evidence-based program that you know their health plan or employer likely covers. Making a referral can be as simple as writing Omada program on a prescription pad or providing a one-page handout with the program's website. Many electronic health record systems are also beginning to incorporate digital health formularies, which will eventually allow for seamless electronic referrals directly from the patient's chart. This process, known as e-prescribing a digital therapeutic, streamlines the workflow significantly. The goal is to make the act of connecting a patient to Omada as easy and routine as prescribing a medication. This transforms a moment of clinical advice into a concrete, actionable step for the patient, increasing the likelihood they will follow through. Once a patient is enrolled, the ongoing workflow integration is designed to be minimally disruptive. You do not need to log into a separate portal or manage a new stream of daily data for all your patients. Instead, the focus is on empowering the patient to bring the relevant information back to you. Omada actively encourages and teaches its members how to have more productive conversations with their doctors. The app can generate summary reports of their weight loss, blood pressure trends, and A1C progress. Patients can easily pull up this information on their phone during an appointment, providing you with a rich, longitudinal view of their health that goes far beyond a single in-office measurement. This patient-mediated data sharing transforms the nature of the follow-up visit. The conversation can shift from asking, "Have you been checking your blood pressure?" to reviewing their actual readings from the past 3 months. This allows for a much more informed and collaborative discussion about their progress and any necessary adjustments to their treatment plan. It respects your time by presenting the most critical information in a clear, concise format. This approach ensures that the platform enhances, rather than burdens, your existing workflow, making it a practical and valuable tool in the daily practice of medicine. One of the most significant advantages that Omada offers to healthcare professionals is the access to a deeper, more continuous stream of patient data. In a typical clinical encounter, the data we collect is episodic. We get a single weight measurement, one blood pressure reading, and an A1C value that reflects an average over the past 3 months. While useful, these are mere snapshots in time. They do not tell the full story of what is happening in a patient's life between visits. They cannot reveal the daily fluctuations, the patterns, or the trends that are so critical to understanding and managing a chronic condition effectively. Omada's platform generates a longitudinal dataset that illuminates this previously hidden period. By encouraging patients to share their progress reports, You can gain unprecedented insight into their journey. You can see the trajectory of their weight loss, not just the net change between 2 visits. You can review their blood pressure readings from different times of day over many weeks, helping to identify patterns like morning hypertension or post-medication dips. This rich, contextual data allows for more precise clinical decision-making. It can help you determine if a medication is truly effective, if a lifestyle change is making an impact, or if a patient's condition is becoming unstable. This data also facilitates a more meaningful patient-provider dialogue. When a patient can show you their progress charted in the app, it changes the conversation from one based on subjective recall to one grounded in objective fact. This can be empowering for both you and the patient. It helps you celebrate their genuine efforts and successes, reinforcing their positive behaviors. It also allows you to troubleshoot challenges with more specific information. For example, if you see a patient's weight has plateaued, you can have a more targeted conversation about what might have changed in their routine during that specific time period. Ultimately, this data-driven approach fosters a stronger therapeutic alliance. It turns the patient into an active, informed partner in their own care. They arrive at their appointments with a clear record of their efforts and outcomes, ready to engage in a collaborative discussion. This level of engagement is what we, as clinicians, strive for, but often struggle to achieve due to time and resource constraints. By leveraging the data captured by a platform like Omada, you can deepen your understanding of your patient's health, tailor your guidance more effectively, and build a more collaborative and successful long-term care relationship. Beyond its direct use as a referral tool, the Omada model offers valuable lessons for healthcare professionals. The first is the impact of small, consistent steps. A second key lesson is the power of proactive, asynchronous support. The Omada model also underscores the immense value of peer support. Finally, Omada's success is a testament to positive, empowering communication. This is perhaps the most valuable lesson we can learn from the Omada model. Omada Health was a pioneer, but the digital health landscape is now crowded. Startups to tech giants are vying for a share, presenting challenges for employers and health plans. Omada must differentiate itself as a comprehensive platform. Managing multiple conditions through a single interface is a key differentiator. Competition is evolving, with traditional providers and tech companies entering the space. Omada must focus on its strengths: behavioral science, coaching, and clinical protocols. This pressure drives innovation, like AI and system integrations. Success requires proving value and demonstrating a vision for integrated, personalized care. Maintaining user engagement and preventing disease progression requires constant innovation. Omada has a strong foundation with coaching, peer support, and data feedback, but must continue to evolve. Another challenge is ensuring health equity, as digital platforms risk exacerbating disparities. Omada can be a leader, proving digital health can reduce disparities. Tackling engagement and equity will be fundamental to Omada's future impact. The greatest opportunities for Omada Health lie in moving toward a future of deeper integration and more predictive, proactive care. A major frontier is integration with electronic health record systems used by clinicians. This would give clinicians real-time visibility into their patients' health between visits, enabling a new level of collaborative care. The vast amount of data collected by Omada opens up an exciting opportunity in the realm of predictive analytics and artificial intelligence. Omada can begin to identify subtle patterns that predict future health risks or behaviors. By harnessing the power of its data to become more predictive, Omada has the opportunity to deliver a level of personalized, proactive, and preventative care that was previously unimaginable. Omada Health provides a blueprint for the future of chronic disease management. It demonstrates that a new model of care is already here, delivering results for individuals. Technology, combined with science and empathy, can extend our reach. By empowering patients with the right tools, support, and community, we can drive outcomes at scale. The platform's success is built on proven science and leveraging behavioral science. The future involves deeper integration, personalization, and a focus on equity, creating a seamless flow of information. The future of care is collaborative, embracing partners as allies in our shared mission.